Hello viewers, welcome to Ayurmegha Health World. Nowadays we see many are suffering from a very common problem, that is knee pains, osteoarthritis. To discuss in detail, we have with us Dr. Nidhi Navani, an Ayurvedic doctor. Let's get in the video and talk to her. Ma'am, many complain that they are suffering from knee pains or else, severe joint pains. They can't even walk properly. So why does these knee pains happen, ma'am?
See, now knee pain can be in different ages. They can be because of different reasons. Now suppose if anyone meets with an accident or something, then they definitely, or there is a tear. We have ligaments in our knees. We have, something like walls, what we call as meniscus. If there is a tear in that, or there is an injury in that because of some sudden fall or some accident, then there can be a knee issue at any age. Okay. So that is one kind of knee pain where we need to repair that inflammation and take care of that, whatever has gone wrong, take care of that ligament tear or take care of that meniscal tear, and the knee pain can be reduced. That is one reason. Now, second most common reason amongst people to have knee pain is what we commonly say as osteoarthritis of knee joint. By osteoarthritis of knee joint, we mean that the gap between the knee joint. Now, suppose this is our thigh bone and this is the lower bone. Okay, knee joint comprises of three bones, basically the upper bone, the lower bone, and there is one more bone known as patella. So, normally this is the joint. In between, we have synovial fluid and there is a synovial membrane. Okay, now in a normal joint, when we walk, it is a smooth walk like this because the fluid is there. It is acting as a cushion. Okay, and we get a smooth walk. What happens as we age? Okay, this fluid dries off. Okay, and especially people who are obese. Okay. Second, people who have a habit on standing on one leg. Many people you will see that whenever they are standing, they will put the entire weight on one leg, knee. Okay, for those people. People who are into sports, especially people who are into badminton or lawn tennis, there they, in those games, they end up putting their entire weight on one knee joint. Okay. So, in these cases, in females especially, because, whenever they are pregnant, they carry that extra baby weight. So, that entire weight falls on the knee joint. Now our knee joint are weight bearing joints. So at a certain point in age, that synovial fluid, it dries off. What happens, and once it dries off, that cushion goes off, and slowly a stage comes when the synovial membrane, it starts rubbing. Okay, once it starts rubbing, people start getting that, experiencing that, a sudden pain in their knee joint areas, which starts with a dull pain, and slowly, as they walk, if they take steps, that all aggravates their pain. Okay, and slowly once that synovial membrane also, by friction, that also it gets degenerated, there comes a point when there is a friction between the bones, and then many people, they get that cut sound also. It's a very common symptom in osteoarthritis of knee joint. Okay, that cut sound will come, and that's a very painful situation. Okay, so this is what is osteoarthritis of knee, and that is how it starts, and what, the weight or the kind of a lifestyle, or if we are into a sports, all this factor contribute to this knee pain.
Ma'am, why we see this arthritis mostly in women?
As I mentioned, see, women, first of all, most of their work nowadays in Indian kitchens, especially all of them, they stand and do the kitchen work. So the weight is continuously on their knees. That is one thing. Second thing, whenever they are pregnant, so they are carrying that extra 10 kgs of weight and then doing all the work. So that again weight is getting, added to, that pressure is coming on the knee joints only. So that is why, they are getting this knee pain very often. Plus then their diabetes. In diabetes, the wear and tear of the body happens very fast. The degenerations happen very fast. So the people who are having diabetes, for them also knee pain comes at an early stage. So that is the reason, women, if they are heavy, if they are on the heavier side, plus because they are pregnant, all this, and they stand and do their work, all this adds to their knee pain coming earlier in life.
Generally, in which age group we can see this osteoarthritis?
See, earlier it used to be at an age of 50 plus, where we used to get this 50 plus females or males coming to us with this knee pain. Now slowly we are seeing a change in the trend, and females who are just 40 plus, 45, they are also they're starting, with the earlier stage of osteoarthritis, which is little alarming. Probably it has to do something with their lifestyle, or maybe in the kind of heels they wear throughout the day and they put pressure on their knees, or maybe their weight, or they're using excess of steps, or they're in a habit of putting their weight on one knee joint. All these factors might be contributing to their knee pain coming at an earlier stage.
What are the symptoms, ma'am? How do we
First
recognize
symptom is knee pain. In and around that area, around this, you will feel pain. At times it is associated with swelling also. Whenever patient is taking steps or especially walking, the pain will aggravate, or if they're walking at an uneven surface, it will get aggravated. Many a times you will see there is a change in the walking style. They will walk like a duck. See, they're not walking like this. You will see the change. They're walking like this.
Okay.
Like how a duck walks. Why? Because to reduce that pain, what are they? They're putting one feet down at one time like this, so that the pain reduces. So slowly you will see that the people who are having this knee pain, slowly there will be a change in their walking style as well. Fourth, I told you, right, that cut sound, that is also very common in this kind of pains.
So how do we diagnose this, ma'am?
Yeah, for confirmatory diagnosis, again we can get a X-ray of knee joint done, and then we can, definitely we can find out, okay, what is the degeneration level, how much the gap has reduced. So all that can be find out in a X-ray.
So what are the treatments available in Ayurveda to treat this osteoarthritis?
Yes. See, in Ayurveda, we have again wonderful treatments where we can see that, that the cartilage regrowth is happening. Then there are special massages which help in, stabilizing those knee muscles. Once the knee muscles are strong enough to hold the joint in place, that because it is now the joint, the gap is reduced, it's something like this. So what we try to do, we try to recreate some gap over here, see that the muscles around the knee joint are strong enough to hold this joint in place, and slowly, if that cartilage regrow to some extent, if that happens, patient will at least have a pain-free life, and they can do their own work.
Ma'am, what lifestyle they has to maintain to get rid of this pain?
Yes. Now, if anyone is suffering, if it's a very early stage of osteoarthritis, I will say immediately don't avoid or ignore it, because it will keep on adding to the problem. Ignoring the problem is not going to help it. Second, many people, develop a habit of taking the painkiller. Please don't do it, because again you are doing harm to your body by adding those extra chemicals, toxins to your body, and definitely you will have side effects in terms of gastritis. So avoid doing that. The best thing is, go to a good physician, get it examined. If it is confirmed that it is osteoarthritis of knee, start working on that. See whatever preventive methods or preventive therapies are available around you to take care of your knee joint. Second thing is, avoid using steps. Please use lifts. Don't use steps at all. You can walk. Walking can be done at level roads. See that, on uneven roads, please don't walk, because that is going to add to your pain. If you have a habit of standing on one knee, please avoid that. See that, if you're working in the kitchen, see if you can sit and do the work. So don't add pressure to your knee joints. There are exercises which will help you in strengthening of your knee joint, and it will reduce your knee pain also. Find out those exercises from the good physician and start doing that. Okay, and if you are overweight, please reduce your weight. You have to do it so that, you're not adding extra pressure to your knee joint. So these are the common things. In food habits, they have to avoid all those heavy things so that they are not adding, weight to their body. Okay, so these are the common things which anyone can follow to see that this knee pain is not going beyond the limit, and it gets controlled and it starts reducing.
So what should be the basic diet routine, ma'am?
See, now diet routine again depends from person to person. So we have to find out, okay, what is the body type of the patient, and what is his daily routine, what is the diet that any patient is, and what is that is adding to the weight or is adding to the problem, whatever is there in his diet. We need to find it out, assess it, and then probably we will be able to give them a proper diet chart, because one diet chart will not suit everyone. It differs from person to person. So it can be done when a patient approaches us. Then definitely as a part of the treatment, we will guide the patient accordingly for the diets as well. Then coming to Ayurmegha is a NABH certified hospital. So NABH certification adds lot of credibility to the center. Plus with NABH certification, if any person is having medical or health insurance, definitely it will be respected by the insurance companies. So in Ayurmegha, if you take any kind of Ayurvedic treatments, everything is reimbursable. So if they are having medical insurances, please let us know, because we'll help you out in claiming of those bills, so that at least you don't have to pay huge prices for the treatment of Ayurveda.